Hello, everyone, and hello to those of you who are joining us on the web. We're filming tonight's presentation so that we can share this information over and over. So please speak up when you have questions, and we'll try to repeat those back so that our listeners later will know the topics that we're discussing. I'm very pleased to introduce tonight Chris Weiss, who's the VP of Advocacy and Government Relations for FAAN. He came to us via a long journey. He drove here today from Fairfax from the FAAN headquarters, about a 3.5-hour drive. And then also, it sounds like his life journey was just the right one to make it to FAAN and to be with us tonight to help us understand the new FAAMA legislation and how it will impact food allergies in the schools. Chris was in education for a number of years and has a PhD in a policy-related issue, went to law school, and then ultimately, through serendipity, made his way to FAAN about 10 years ago and has been their policy person ever since. So he's known of the FAAMA from its idea stages, and now it's part of new law that he'll tell us about and help us to learn how we can use it to increase safety and quality of life for kids in schools who are living with food allergies.
Thank you all very much. It's nice to be here. Lucy mentioned the acronym FAAMA, F-A-A-M-A. Some of you, I'm sure, are familiar with this, but some of you may not be. FAAN we're very pleased at what we've accomplished this year. We essentially got a federal law passed in the U.S. Congress, and that is not an easy thing to accomplish. But we did it, and we're very pleased about it. This law, FAAMA, was initially introduced back in 2005. And the reason I know this is because we had our first Kids Congress event in the fall of 2005. This is where we brought a bunch of families from across the country who had kids with food allergies. We brought them all into D.C. and arranged for them to meet with their lawmakers up on Capitol Hill. FAAMA, this legislation, was part of this Kids Congress event. The text of the bill was actually written in August of 2005, and I know that because I'm actually the fool, I guess you'd call, for lack of a better word, who actually wrote it. And I remember staying up, really late at night for about a week straight, trying to write a piece of legislation. So this was back in 2005. So it only took us, 6 years to get it passed? So it was finally passed this January, 2011. And interestingly, it passed, it became part of a larger piece of legislation. For those of you who follow politics, some of you may, during the lame duck Congress this past December, there was a lot of talk about something called a food safety bill, which was supposed to, restructure the FDA and spend a lot of government money. Well, FAAMA, the food allergy legislation, ended up becoming part of this big food safety bill. And that was thanks largely to Senator Chris Dodd from Connecticut, who is now retired, but he has a daughter with food allergies, and so he was sort of the champion in the Senate behind this bill. For those of you who actually want to look it up, the final bill was H.R. 2751, and FAAMA is Section 112 of that House resolution. The entire food safety bill is something like 600 pages, I think. It's massive. So the overall accomplishment of this bill is what we will see is we will see the federal government, create a voluntary set of national guidelines to help schools manage students with food allergies. That's the overarching purpose of the legislation. Also part of the legislation is, are some grant incentives. Supposedly, school districts that embrace these voluntary guidelines will somehow be eligible to receive some federal grant money to help them implement food allergy policies. The details about this grant money are still being worked out. We don't really know a lot about that at this point. This is who the guidelines will apply to. Early childhood education programs, such as Head Start, Early Head Start, certain child care programs, state pre-K programs. The guidelines will also apply to public kindergartens, public elementary schools, public high schools, sorry. So you'll see the guidelines will essentially apply to all types of schools and child care centers that somehow get federal financial assistance. So the question of whether these will apply to private schools is probably undecided or unclear at this point. So according to the legislation, okay, these guidelines have to be developed no later than 1 year after the bill was finally passed. That translates to January 4th of next year. According to the legislation, it puts the burden to create these guidelines on the Secretary of Health and Human Services, or HHS, in consultation with the Secretary of Education. So HHS and the Department of Ed will develop guidelines to be used on a voluntary basis. So, you know, unfortunately, they're not going to be mandatory, but we needed to make them voluntary, or else the legislation really had no chance of passing. So they will develop guidelines, voluntary guidelines, to help schools manage the risk of food allergy and anaphylaxis. HHS and the Department of Ed will then make the guidelines available to local educational agencies or school districts, schools, early childhood education programs, and other interested entities and individuals, which is a pretty broad phrase right there. So what we will see is the federal government will somehow make these guidelines available. They'll probably be posted on various federal websites, things like that. Now, according to the legislation, these are all the things that the guidelines need to address, okay? And first and foremost, it's this notion of a parent's obligation to provide certain documentation to the school, probably from either a doctor or a nurse. And the documentation would concern, for example, the diagnosis of the food allergy and the risk of anaphylaxis, any history of anaphylaxis. Am I getting feedback? Or? Yes, that was a yes, right? Okay. Any prescribed medications, certain emergency treatment procedures, so something that you might see on like a food allergy action plan, signs and symptoms of a reaction, assessing whether or not the child is ready for self-administration or to carry his or her prescribed epinephrine at school. So again, it's the obligation on the part of the parent to provide the school with documentation concerning all of these topics. And also, excuse me, a list of substitute meals that can be offered by the school cafeteria. So that's the first thing the guidelines need to address. Second thing they need to address is the creation of an individualized management plan. So in consultation with the parent, of course, individualized or tailored to the needs of each child. The plan should address the child's ability to self-carry or to self-administer. So that's point two. So we're talking about the creation of, I guess, a written management plan. It could be an individualized health plan, could be a food allergy action plan, or the LAMP form, which is the new term I learned tonight. The guidelines also need to address communication strategies between the schools and emergency medical services providers. I'm not sure what the situation is here in the Norfolk area, but we know that in some states, EMS and EMTs, there's a chance that they may not be allowed to actually have epinephrine on board the ambulances. And even if they do have it, they may not be able to use it in the field, depending on the type of EMT that they are. So certainly this is something important that schools would need to do. The next thing the guidelines would need to address would be strategies. This is exactly the way that it's written in the bill. Strategies to reduce the risk of exposure to anaphylactic causative agents. So that's a pretty broad statement right there. And some examples of some strategies would be, what to do in the classrooms, what to do in common areas, such as cafeterias, hallways, playgrounds. The next thing the guidelines would address would be somehow getting information out on food allergy. Okay, so this sort of act of educating people. This would include educating the school staff, educating parents, educating the children, the students at the school. The guidelines will also address how school personnel are trained, and ideally this would be people who work at the school who are most likely to come in contact with children who have food allergies. The guidelines will also address training school employees to administer epinephrine if the school nurse is not immediately available. So I'm not sure what the coverage is like in the Norfolk area with school nurses. I would assume that most schools do not have a full-time school nurse. I would assume that, because that seems to be the case in most parts of the country. Okay? In fact, the only state that I know of where every school has to have a full-time nurse is Delaware. It's the only one I've heard of. So again, the guidelines would talk about this notion of, I guess you'd call it delegation, teaching other people to act on behalf of the nurse when the nurse is not available. The guidelines will also address responding to an anaphylactic event during things like extracurricular programs, okay, things that are not really normal educational facets of the school day. Things like non-academic outings, field trips, before and after school programs, school-sponsored events held on weekends that are maybe held on the school property, but during non-school hours. So again, the guidelines will address how to respond to anaphylaxis occurring during any one of these types of events or activities. Next thing the guidelines will address is somehow maintaining information on the usage of epinephrine at the school. So far, there have been a couple of states, Massachusetts, New York, and Connecticut, that have required over the last couple of years Whenever epinephrine is given anywhere at the school setting, the school nurse needs to fill out a form, like a one-page form, describing, okay, what happened, where did the allergic reaction occur, what triggered it. And so we'd like to see more of that type of data being collected throughout different parts of the country. And so the guidelines from the federal government will address how schools can collect that information. Now, a lot of people have asked about FAAMA because we know that some states already have published food allergy management guidelines. In fact, about 13 states have done so. And so we've been asked, well, you've got these states who have guidelines. Now we're going to have the federal government that has guidelines. Does that mean that the federal guidelines are going to trump the state or vice versa? And the answer is that there really won't be any effect. The federal guidelines will really complement those that already exist at the state level. As well as guidelines that have been developed maybe by school districts. Okay, so the federal guidelines won't negate any other guidelines that have been created. They'll merely complement them. So the big question, who's going to write these guidelines? Okay. Most likely, it's going to be a division of the CDC called the Division of Adolescent and School Health, or DASH. They are based down in Atlanta, at the CDC office in Atlanta. And interestingly, DASH sort of saw the writing on the wall about 4 years ago and predicted that FAAMA would someday get passed. And so about 4 years ago, they sort of got ahead of the game, and they commissioned a number of organizations and had a series of these expert workshops. And the groups that were involved have been FAAN, NASN, which is the National Association of School Nurses, NSBA, which is the National School Boards Association, and there were a number of other groups and organizations involved as well. But DASH is essentially maybe 80% done in creating these guidelines. So you remember back to an earlier slide, the guidelines have to be released by January of next year, 2012. We feel pretty confident that they will be. In fact, we may even see them this fall or this summer. And that is all I have. This is me, and if you have any questions, that's my office line, my direct line at the FAAN office. Feel free to call me or shoot me an email. And now you're just burning with questions, I can tell. Yes?
I was just wondering, in the expert panel, was some of this from FAAN?
Yes. Yeah. FAAN had about 3 people there. There were medical organizations as well, like the AAP, Pediatrics, the Academy of Allergy, Asthma, and Immunology. Okay. So the expert panels were very well represented. Yes? Mm-hmm. That will be addressed as well.
Can we repeat the questions or?
Oh, sure. She's asking about whether or not the guidelines would be applicable to transportation issues, such as the school bus. And yeah, I guarantee that they will. Sure. Sure.
Would you predict that, I realize it's not a fair question, but would you predict, or would it be your guess, because it would be my guess, that with these voluntary guidelines that schools will start to adopt them more and more, particularly since there's parental advocacy for that. I mean, I would envision it someday that it'll be every school will have something like this.
We'll get there ultimately. Yeah, I would totally agree with that. You know, going back to the whole voluntary deal, when the bill was initially written, we met with some legislators from both sides of the political aisle. And I have to be delicate when I talk about that. So what we learned pretty quickly is that the guidelines had to be voluntary, or else one side of the aisle would never have supported them. And I won't say who, but you can probably guess. One party felt that school issues are best handled at the state level, and that the federal government really shouldn't be involved in that. So we learned early on that we had to make these guidelines voluntary, so as, you know, to give states the option of maybe embracing them as a whole or not embracing them at all. There's a flip side to that argument, though, which is that even though the guidelines are voluntary, the fact that they are going to exist at the national level, it's almost like an indirect mandate, because you could argue that if a school chooses to ignore these national guidelines, then the school's not really engaging in best practices and is therefore maybe setting themselves up for perhaps some negligent behaviors in the future. So,
Do you know if Dash's work, or would FAAN follow perhaps with including guidelines for parent groups that want to advocate within their school district and assist in getting these things adopted? Would there be some guidelines for that?
Not as part of this, but my strong hunch is that Dash that's going to be the next sort of big project. And a lot of that, I think, will sort itself out when they figure out how to deal with this whole grant money incentive. So, you know, if school districts are going to be able to get money for embracing these guidelines, then districts and parents are going to need some guidance from Dash as to how to actually get districts to implement these.
I can speak up. You mentioned that there's 13 states that have guidelines.
That's right, yeah.
In place already.
Uh-huh.
Would you happen to know if any of those have them as mandatory guidelines?
None of them have them as mandatory guidelines.
And I'm assuming, since you didn't mention that Virginia's one of them, I'm assuming Virginia is not.
Virginia is not, no. No, no. Which really kills us because we're based in Virginia. So, but our county has guidelines, Fairfax County. So, and I would assume that the reason all of the state guidelines are voluntary, it's the same political reason. Because all of the guidelines were created as a result of legislation, which had to pass through, you know, state legislatures. So, yes. Absolutely. Uh-huh. Yeah, absolutely. Oh, she's asking if she sees PTAs as being in a position to help school districts implement these guidelines. Yeah, absolutely. Yeah. Mm-hmm.
So what I'd like to do next is, since we have such an expert here from FAAN, and although he doesn't know that I'm about to blindside him with this.
Excellent.
And clearly when we come back to this recording, if we need to stop it here, we can do that.
Okay.
If you feel like there was something that you said that was controversial and you don't want it out there, this could
I didn't
be...
mention the political parties.
This
so.
could be, no,
Yeah.
this could be a natural breaking point. But one of the things that I think Chris is such a great resource is that he manages on a day-to-day level all of the, you know, phone calls and emails and letters that people send that come in about There are situations at school. Certainly there's the case in Florida that's been on the news the last couple of days. And I'm sure that many of you have questions about, do I need a 504? What do I do about X, Y, or Z situation? I'm the school nurse, and I'd like to implement a non-designated EpiPen for our school. Some of those kinds of things. We have the resource here. So I'll buy you dessert, so maybe you won't be really mad at me. But what I'd like to do now is open them up. Now, in the event that this turns out to be something that may be suitable to answer some questions for some of the other school people that were not able to come today, I will go ahead and use the mic and tape it, but certainly if you feel like you're limited in an answer because you don't want it on the record, I'm certainly happy to delete it, and we'll see what happens from there. But don't ask him anything personal so that he won't feel obligated to answer it. So let me start from there, and I know we do have some school educators and nurses with us, so who wants to go first?
How old is the little guy? Okay, so at this point you really have no reason to know what a 504 is. Okay, a 50, that's not a simple answer. Well, no, I guess it is. A 504 plan, okay, is a written plan that could be available to you as the parent of a child with food allergy. And the written plan would be developed in collaboration between you and your child's school, okay? And the written plan would sort of address the ways by which the school will make sure that your child's food allergies do not affect his ability to sort of equally participate in the normal facets of the school day. Arguably, yeah. 504, the reason it's called that is because it comes from a larger civil rights law that was passed back in the early 70s. And the civil rights law is basically Section 504 of that bigger law pertains to schools that get federal money, so public schools and some private schools. And it's putting the burden on those schools to make sure that they don't discriminate on the basis of a disability. It's sort of like the precursor to the Americans with Disabilities Act, or the ADA. That didn't go into effect until the early 90s. But, and for the purpose of 504, it's generally understood that if a food allergy is life-threatening in nature, then it qualifies as a disability under 504. So some kids with food allergies have 504 plans. Do all kids with food allergies need a 504 plan? No. But some do. Some have 504 plans. I think that from my experience, and again, I've been with FAAN, I just hit 10 years, and I speak with people just about every day about what's going on in their school districts. The sense that I get, so this is my informed opinion, is that creating a 504 plan involves some amount of administrative burden on the part of the school. Because it's based on a federal law, my understanding is that certain files need to be created at the school, certain meetings need to be held. It's rather a formal process from beginning to end to develop this plan. And that formal process, I think some schools feel that it's a bit too burdensome. And so what I see is schools sort of trying to steer parents away from a 504 plan and say, well, we don't need a 504 plan. We understand your child has food allergies. We'll develop another type of plan instead, and the plan will be just as effective as a 504 plan. And so that saves the school some time and effort in developing this plan. And it also satisfies the parent because, this other type of written plan could be just as effective as a 504 plan. Yes? Uh-huh. Mm-hmm. Well, I would actually yield to any school nurse in the audience, other than the one who asked the question. I can try to answer it. Well, the way I understand it is that it really depends on each individual school district, or maybe each individual school. I know that standing orders are possible in some locations, but there's no state law in any state that I know of that either expressly prohibits standing orders nor expressly allows standing orders. So it's really a mixed bag throughout the country. So, I would ask whoever your higher up is, I would go to that person. Yeah. Generally what it is it's a local pharmacy writes out a prescription for a non-student specific auto-injector to the school nurse. And then the school nurse takes the auto-injector and keeps it on hand. That's not the way I see it, yeah. But the regulatory or policy mechanism has to be in place for her to even go to the pharmacy and have the pharmacist do that.
Do you think FAAMA will address this issue?
Yes, I do. Because believe it or not, if you follow the news, you may have heard back in November, there was a 13-year-old girl who unfortunately passed in the Chicago area due to peanut anaphylaxis. And the sad part of that story was that she had been diagnosed at a very early age, but for some reason her parents that last year decided that she didn't need an auto-injector on hand at the school. I know it's inexplicable, really. But so, we make the argument that had the nurse had standing orders, that girl's life could have been saved. And I know that there's a legislative movement in Illinois right now to pass a state law that would allow all nurses in that state to receive standing orders. Yeah. Yes? Well, that's all hypothetical because the problem, and I know that liability was part of your question, any or all liability questions involving kids with food allergies, 99.9% of them are unanswered because there's no legal precedent. And liability is a hypothetical question. Could I be liable if? Well, I don't know, maybe, but there hasn't been a legal case that addressed that. So we have no black and white legal yes or no answer. Yes? Yeah. Huh? Mm-hmm. Mm-hmm. Did they expressly contain peanuts, or was there a may contain statement on them? So they weren't packaged food items? Yeah. Oh, okay. Okay, okay. Okay. Well, I mean, yeah, I don't know. I mean, you know, obviously what the nurse did was wrong, obviously, and everyone's going to agree with that. All we can hope for was that it was brought to the nurse's attention. You said that she did apologize, and so, you know, it'll never happen again. So. But certainly, I mean, you know, in a situation like that, and this sort of goes back to the whole liability issue, you know, a liability sort of lawsuit is going to be based on, well, whose fault was it? So, you know, in that type of scenario, if a school employee does something, that's pretty negligent on the part of the school nurse, absolutely. So,
I have a corollary question that sort of goes with your question. And first, I was wondering if we had a Good Samaritan law in Virginia, and you figured I would know that, but I don't. And then second, this issue of MAT training in schools. So teachers and nurses, for those of you who don't know it, this is my rudimentary understanding. I am a physician, but MAT training is a training to certify teachers and school nurses for giving medications. But I'm wondering about the situation where there is a teacher who's MAT certified, but there may be other teachers there who are not, and I'm told by the director of one of these schools that's under a state institution that only the MAT certified persons can administer medications, and it seems to me that in an anaphylaxis setting, you know, student teachers and so forth who are aware ought to be able to do that if for some reason the MAT trained person isn't standing right there to do it.
yeah, that issue comes up every now and then. It's come up in New York State a bunch of times. I don't think anybody knows the answer to that. I don't know the relationship between the MAT certified people and potential delegates. Just don't know. I don't think there's any regulation or law or policy that specifically, you know, brings those two things together.
Well, it's interesting because the person I talked to, who's the director, says it can only be the MAT person.
Well, I ask her to back it up, and I bet she won't be able to.
Yeah.
What is the Good Samaritan law?
It's basically every state has one, and it's there are something like 5 parts to it. So it basically protects somebody from liability if they help somebody who's in an emergency. And the parts that there are, like, it seems like so many things in law is like you have to, you know, is something negligent? Well, okay, you have to go through like 5 different parts to figure it out. But with the Good Samaritan, it's the person has to render emergency assistance in good faith with no expectation of payment, and they give over priority of the individual, of the patient. They yield authority over to EMTs or emergency medical people who arrive at the scene. So, or a school nurse who arrives at the scene. So, you know, arguably if those things are met, then the person would be protected by the Good Samaritan law. Again, though, the problem is that I'm unaware of any legal cases that look at somebody helping somebody with epinephrine during an emergency and whether or not that person is covered by Good Samaritan law. I just don't think the precedent exists out there. So, yeah. None that I'm aware of. No. No. Sorry. And I'm sorry, the woman in the back had a... No? Okay. Oh, good, okay.
So theoretically, you could administer epinephrine under the American law because they're having trouble and you've got it and want to give it, and no one's ever been sued yet for that, correct?
Correct, yeah. Theoretically, because, you know, and again, keep in mind, epinephrine is a benign medication. So, you know, another thing to think about with liability issues is that usually a lawsuit is brought when somebody gets harmed. So if you're dealing with epinephrine, which, you know, really isn't going to hurt anybody, how could you sue somebody for that? So.
I'm aware, not in great detail, but I'm aware of a situation where a nurse used another child's EpiPen when it was the first presentation of severe food allergies
Yeah.
at school, and the nurse was fired from the position.
I mean, I've heard stories like that, but I've never seen any direct proof. So, I mean, that could very well be true. Yeah. It's sad, but...
Do we have any other questions or issues that have come up in school that, do we have any broader questions for FAN in general?
Yeah. Just this year started? Ooh. This was, I'm sorry, this was a child care center? A preschool, okay. Possibly, but you know, I don't know. Well, I'm more concerned though with the fact that they only this year started accepting kids with food allergies, because I mean, actually, there is legal precedent involving privately run child care centers refusing to accept kids with food allergies. And this precedent is like 10 years old, and most of the child care centers throughout the country actually refer to this precedent. And so we rarely hear about kids being turned away, especially at such a young age. So I'm more concerned with that. No. Yeah. Yeah. But I would even debate that, whether or not she's going to get a code violation. My initial instinct is that she doesn't fully understand what she's talking about. And I'm sure that she's very nice. I'm sure. You know, but...
She could call you.
And then we can both be confused. You know. Yeah, okay. Yes, go ahead. Hi. You're welcome. Mm-hmm. There are sort of two schools of thought on it, and you know, even though I've been with FAN 10 years, I don't really fall onto either side. You know, some parents like 504s because they feel some sense of comfort knowing that their child has a written plan based on a federal law that involves a formal procedure, and the plan gets revisited every year and gets revised every year. And according to the 504 law, there are certain complaint procedures that the parent can follow if the parent feels that the school is not living up to its end. For example, the parent can complain to, it's called like an impartial, can have an impartial hearing. And I put the word impartial in quotes because usually the people on the panel are the same people at the school that the parent has been dealing with all along. So that's sort of the argument for a 504. I think it's this sense of comfort coupled with these formal complaint procedures. And, you know, and also you've got a part of the U.S. Department of Ed called their Office for Civil Rights is like this big federal agency that oversees 504. And so ultimately a parent can complain to the Office for Civil Rights. You know, so that's the argument for. The argument against is the fact that, you know, some schools have good food allergy management practices already in place. Some schools do great jobs and they don't do 504 plans. Maybe they do another type of written plan. And so in that type of scenario, you know, if the school is going to do a good job anyway and the parent feels comfortable with that, why should the parent then, you know, sort of make the school do extra things by creating a 504 plan? Okay. Okay. Yes, you could. Well, but even if you didn't have a 504, or if you don't, most schools have complaint procedures as well. I mean, you can complain to, I don't know, the principal, then the superintendent, and then maybe the State Department of Ed. So, you know, you could make an argument that any sort of remedy available under 504, there's an equivalent if you don't have a 504. And I know that, you know, again, going back to the two schools of thought, there are a lot of parents in this country who are absolutely committed to getting a 504 plan, and they will defend it, you know, forever. And I respect that and I appreciate that, you know, but I don't think that they represent the majority of parents in the country. So. Places that get federal financial assistance. Academic, yes. Yeah. Uh-huh. You could make that argument. How old are the swimmers? Yeah. Yeah. The swimming is the swimming is an optional activity though, right? So they're on this, what is it, like the school swim team or? Okay. And they get federal financial assistance? Okay. Okay. So they might. You could make that argument, yeah. You could ask for that. You might get shot down immediately, but You know, you could at least raise it. Sure. You know, I was going to say there are sort of two interesting things about 504. The likelihood of getting a 504 plan, there's sort of an inverse correlation between age and the extent to which something is part of the normal school day. 504 plans are much more common with young kids, you know, elementary school, first grade, second grade. But as the child gets older, the likelihood of them getting a 504 plan decreases. So by the time kids get into high school, you know, 504 plans are relatively rare. When kids go to college or university, they're almost non-existent. Even though some colleges get federal money, but you know, you really don't see them. And then there's this other weird correlation between something like a mandatory field trip as part of science class, where every kid in the class has to go, and it's part of the curriculum. And maybe they're going to write a paper about it and get graded on it, so that it's not an optional activity. 504 seems to embrace the mandatory facets of the school day more so than any optional activities that go on at school. So.
And I just want to shift directions for just one second, because you're such the expert on this too. Can you speak for us a little bit about some of the advocacy issues that have to do with school bullying, and you know, some of the things that the teachers or the parents, and what are the rights of the family, and you know, can you give us a little bit about, you know, some of the cases that you may have seen and what the outcomes were, and speak to that briefly if you don't mind.
Well, yeah, I can talk about it. Probably can't give you the information that. No, I don't think that there's, again, I'm unaware of any sort of legal precedent involving legal action with kids on the basis of food allergy. We get reports all the time of kids with food allergy being bullied at school or having, you know, just bad things done to them. We've seen cases where local police have been involved, and, you know, kids have actually been charged with attempted murder or, you know, assault. We've seen cases like that, but we haven't really seen any legal decisions based on that, okay? And, but going back to the FAAMA guidelines, I know because I was a part of those expert panel workshops that they held, and I know that bullying came up often, and every organization in that room agreed that this is something very serious. And so I would guarantee that bullying will be addressed in these national guidelines. Absolutely it will. Okay. Yes? Mm-hmm. Right. Yeah. Okay, stop the tape. No, I don't care. That's fine. My experience is that, my experience, not FAAN's, well, I guess I speak for FAAN. My experience is that schools and school districts who try to go peanut-free often encounter numerous obstacles that force them to reverse their decision. So, boy, that sounded like a great, safe answer, didn't it? Yeah, that was good. Sounded like a politician.
Are there any milk-free school districts or
Not,
egg-free school districts?
not that I'm aware of. I mean, look, allergen-free school districts, you know, probably peanut. I don't know of any. And I know, you know, people say that they exist, but again, I have no direct evidence that there is a single school district where every school in that district is peanut-free. So, you know, if somebody knows of one, do share. What is way more common is maybe something like a peanut-free classroom in a school, or maybe a peanut-free zone in a school, or a peanut-free table in the cafeteria, things like that. I've heard of milk-free classrooms and tables, not as much as the peanut. I think that one interesting trend that I think we might be seeing is the notion of a food-free classroom, food-free classroom. And so what you're including everyone in that. And you know, look, well, I'm 44. When I was in elementary school, I don't remember food being used in the classroom. So I don't know why it seems to be such a big deal these days. But, yeah. Uh-huh. Well, lunchboxes can be kept outside the classroom. And also, lunchboxes, they don't have to be opened. You know, they can be kept somewhere where the kids can't get to them. So.
Okay, so.
Oh,
Oh, wait a minute,
hold
you
on,
had another
hold on,
question,
hold on.
sorry.
Yeah. Good. Okay. Right. Well, I think that this notion of reducing the presence of food in classrooms, this is going to be addressed by these federal guidelines. Because I get the sense from people at DASH who I've spoken with that there's a growing concern that there's too much food in the classroom these days. Not only, you know, as part of snacks or celebrations, but also as part of classroom projects or academic lessons. In fact, I mentioned earlier the 13-year-old girl who passed in the Chicago area. What triggered the reaction was a type of celebration, and the class had catered Chinese food. And that's what caused it. And allegedly, you know, we don't know because we weren't there, but it's been alleged that the school confirmed with the restaurant that the food did not contain peanuts. Again, that was alleged, but we'll see. And I believe the parent has now sued the school and the restaurant. So you might be seeing this in the media in the coming weeks. Sure. Yes? Right. No, I see that. Yeah. Before I answer that, let me, because you mentioned that you were thinking about whether or not to look into a peanut-free school or, okay. Some things, if I could just look at that phrase, peanut-free school, and this kind of goes back to my previous answer. You know, think about the difficulties involved with actually defining that phrase. You know, if I look at that phrase, 10 questions come to mind. For example, does it apply to what the school serves? Does it, well, hold on a second. Does it apply to what the school serves? Does it apply to what kids bring in from home? Does it apply to adult staff members? Does it apply to vending machines? Does it apply to events held on school property during non-school hours? Does it apply to extracurricular activities? And probably the most maddening question, does it apply to may-contain statements? So, you know, the more you sort of look at that phrase, the more difficult it becomes to define. So I would just caution you, caution you that if you were to find a school that, you know, says, oh yes, we're a peanut-free school, I would really have a long discourse with them about what exactly that means. Okay, so then your original question, I definitely see a trend that more and more schools are embracing food allergy management policies. Without a doubt, that's where we are trending. Because, you know, I've been with FAAN 10 years, so I've been able to see over the past decade the number of schools that are actually doing something about this. And that's definitely the trend. Absolutely. Sure. Yeah. Okay.
My daughter was, she also is allergic to macadamia nuts.
Uh-huh.
She had all the rest of the nuts, and she eats almonds quite simply. So I made dessert with an almond cake. She took 2 bites of it, and her face swelled up. So I contacted the company, and she like, I checked the box, you say anything about any of the nuts.
Uh-huh.
Nothing. So I contacted the company says, well, the product is imported, but it's solely dedicated to almond cake facility. That's all they have on. So I gave her something else to test to see if it was, maybe she was having a reaction to almonds. So I gave her some almonds. She ate the almonds just fine. So I
Good.
contacted the company again. I said, look, now I've done another test. And said, I've given my daughter almonds. She ate them. She was fine.
Right.
I gave her your almond paste. Her face swelled up like a balloon. So, I mean, I don't want to see this something that's not what I'm going for, but I feel like they're not taking me seriously.
Well, what was on the label?
It was, well, it's just an almond cake. So it basically just said it had almonds
Uh-huh.
and it had sugar and flour. And that
So almond was listed on the label.
almond was just an almond cake.
And there was no type of may contain. Well, you know, my initial response when you were telling that story is, I don't know if I'd buy imported food.
Well, when I bought the almond cake,
Yeah.
it was from a company based out of Connecticut. So that's what I was looking for because I normally don't buy.
So you didn't know that it was imported food when you first...
So when
Okay,
I
all right.
contacted them, when I found out this company also has several different Thai food lines, and
Right.
that instantly, And so when I contacted them, they said, oh no, it's imported. I'm like, well, your packaging doesn't say that it's imported from a different...
Here's what you could do. Do you still have the product?
I have the packaging at home.
You have the packaging, but do you have any of the product left?
All of the products when I made it.
Because, you know, there are outfits that will actually test for the presence of major allergens. We work closely, you could conceivably buy the same product and have some of it tested.
It had like a lot number of the basket.
Right, right.
So I said, because I told him, I don't want
okay.
to say that you're lying, but I'm telling you that this company that you imported your product from has other types of nuts in their facility.
Mhm.
My kids can't eat almonds, and then have a reaction to almond cake.
Mhm.
With it not being cross-contaminated. I said, I'm going to go find another one. I'm going to go back to the same store, buy the same batch number, and I'm going to have to test it. I said, and if I have to test it, then I have legal precedent
Mhm.
against you, because there's the Truth in Labeling Act. And then we have these things that say, the Truth in Labeling Act is not true to them. So get the product in the United States. It does apply to you, even if it's an imported product.
It does apply to them. Of course it does.
Exactly.
Right.
So,
Yeah, I mean, look, in your situation, I don't know. I don't really know what your remedy is other than having it tested. I would want to have it tested just out of curiosity. You know?
I was really frustrated. So, I mean, it's basically like you're one of those Cracker Jack kind of parents that thinks that their kids are free. And, thankfully I wasn't like the only one there. I was at a dinner party and all my friends were all like, oh my gosh, she's going with the kids. And her eyes, they instantly swelled up. And they're like, I thought she was allergic to almonds. I never would have made a dessert that my kids were allergic to.
So if you don't already know this, the best place to have a product tested, if you want to go ahead with that, is at the University of Nebraska. And there's a part of that university called FAARRP as in Peter, and it's the Food Allergy Resource and Research Program. And I think they're FARRP.org, and you can find the instructions as to what you can do. But Steve Taylor is the guy who runs that outfit, and he's been on our medical advisory board for years. And he's a wonderful person. Okay. Sorry I don't have a better answer for you, but.
Well, I guess it's, I don't know the whole legal aspect of it, but when they're trying to tell me that because it's an imported product, it doesn't apply to
Imported, but the food labeling laws apply to imported packaged food items. Absolutely they do. So, and again, not that you're going to do it, but even if you were to think about legal action, you'd have to get the product tested anyway, because that would be your ultimate proof, right? So.
Okay. So I'd like to very much thank everyone for coming out, and I'd also like to thank Chris for a very informative talk. I will just put a couple of plugs in. We are moving forward on the FAN walk that's going to take place this fall. Please check the website. Through activities like the FAN walk, we're able to continue to support Chris and his work in making our schools safe for children, and every contribution that you make towards FAN goes to wonderful things around the country towards making food allergies hopefully someday a thing of the past. In addition to that, I do want to put a plug in for our May meeting. Our May meeting, I think it's the 19th of May. Don't quote me on that, but I think that's what it is. We are having one of the researchers come down from Johns Hopkins. Her name is Kim Mudd, and she's going to come down and talk about their experience with milk allergy there and their desensitization studies. So we're going to bring something aside from peanut and talk. They're also doing some peanut desensitization trials, and she may talk about that also. But it's an opportunity, especially for the people that have milk allergy, to come out and have some good news in regards to milk allergy too. So with that, I'll adjourn our meeting, and thank you all. And I think Chris will be down front here for at least another 2 or 3 minutes for questions if you need him. Thank you again.